also in coaching many, many students in effectively treating parasite infestations. And also the successes of students right now that are in the process of recovering from chronic disease by treating these parasitic infestations. If we haven't met, my name is Pam Bartha, and I am the author of Become a Wellness Champion and the founder of Live Disease Free. And it is such an honor for me to share this with you because 30 years ago, I was diagnosed with multiple sclerosis, and I was so incredibly blessed, I would say by the grace of God and a lot of work on my part, learned very early on that multiple sclerosis is caused by chronic infections in the body. Learning this really helped me to change the course of the treatment plan that I wanted to follow. So I did not follow standard of care, but instead I chose a path of treating the cause, which is chronic infections. A lot has changed since that time. So that was 30 years ago. And today we are now helping people all over the world recover from chronic disease, especially multiple sclerosis, by treating parasitic infestations. So I'm going to share a few important insights with you that really help you to understand what it takes to recover from chronic disease, because chronic disease is the main cause is infections in the body. And I would say that these insights are huge because yes, there are integrative practitioners that would really like to help us, and they understand about Candida and Lyme disease, and they talk about parasites, especially the small protozoa. But many of our really well-meaning integrative practitioners and medically trained doctors, they just don't know how infested we are. And they just don't know the extent of how large the worms are, etc. And we do because we've seen them. We see them coming out. I have personally passed a lot of parasites. All I can tell you is that the more you deworm, the younger you feel. And so today, again, the topic is really talking about, number one, treating the parasites, the insights that we've gained. We've helped over 600, we're probably getting close to 700 students in the Live Disease Free Academy. Most of the students that I work with suffer with multiple sclerosis, but other types of chronic disease also, a lot of neurological diseases. And so we're really working hard at helping them to effectively treat the parasites. So we're going to talk about how to effectively treat the insights that we have and also the successes of our students. The first thing that we have to really understand, the first insight, is truly that all chronic disease is caused by infections. So that would include all autoimmune disease, that would include cancer, heart disease, any chronic disease. And if maybe we don't have a disease label yet, but maybe we have symptoms, maybe we're dealing with digestive symptoms or cognitive function impairment or mood, etc. Those are warning signs. Those are warning signs that the infections are becoming more populated in our body. And if we don't treat them, then we end up with chronic disease. Just want to say hi to Brian and Aurora. You guys can all hear me. Awesome. So the first thing we have to understand is that all chronic disease is caused by infections. And if you are new to all of this, then make sure to watch some of my previous videos, and you can find them on Live Disease Free on Facebook and Live Disease Free on YouTube. And I have a playlist there, and I've done a lot of different videos, especially for the types of infections that are involved with multiple sclerosis. But I can tell you that all the students I work with, whether they're dealing with Lyme disease, whether they're dealing with MS or diabetes or inflammatory bowel or different types of inflammation, maybe it's arthritis, PLS, they're all following the same steps. They all have parasitic infestations. And so parasite is anything that lives inside of us and not just feasting off of our food, but causes our immune system to react to them, to fight them, because our immune system does not want them to be in us. So any type of inflammation in the body, it's all the same. So we're dealing with lots of worms and protozoa and bacteria and fungus, etc. And we all have to take the same steps. So whether you're dealing with MS or Parkinson's, or maybe some other autoimmune, or maybe you don't have a diagnosis and you're just not feeling well, all these things I'm sharing with you are relevant to you also. The key is that if you feel you're pretty healthy, the way to stay healthy is to manage the microbes in your body. So if you start to get little warning signs, if you treat the parasites when they're in small numbers, then you avoid dealing with chronic disease like I have and like a lot of other people have. And it's awful. It's a lot of work. It's a lot of pain and agony and a lot of cost getting sick. So you don't want to get sick. So again, number one, the biggest thing is you have to understand that your chronic disease, the biggest cause, what's causing all your symptoms are microbes, infections, largely parasites. It's not a mystery. It's not something unknown that you can't deal with, and it's not something you need to suppress your immune system. You need to treat the cause. The second one is that parasitic infestations are not just an issue in underdeveloped countries or third world countries. Very important to understand that parasites are a concern in all the developed countries. And the next thing I wanted to share is that the sicker we are, the more infested we are. And there's so much truth in that, because my students send me many, many pictures. I have hundreds of pictures of worms because we are treating with parasitic drugs and we're using herbs and we're also doing enemas, so we're flushing them out and we see them. So our students are passing worms that can be up to 2 feet long very often, especially the students that are recovering from Lyme disease, but also MS. I've also seen intestinal flukes, which are about 3 inches long. They're a flatworm, they're disgusting, and they cause a lot of gut pain and other neurological symptoms also. So we're seeing all kinds of worms. Some of them are smaller, some of them are 4 inches, 6 inches, and up to 2 feet long. And the flukes, some of the roundworms, one of them from our students was actually examined by a parasitologist, and he said it was a whipworm, a really big whipworm, and they can cause a lot of agony inside of us also. So we have to, number one, it's knowing that our symptoms are caused largely by parasites. Number two, that this is an issue in all the countries, not just the underdeveloped countries. Parasites are in our soil. I've done videos on this. You can go back and listen to them, but they're all around us. They're in our soil. Our pets have to be dewormed. They come in on our produce. We can get them if we're eating in restaurants. Like, you can't avoid them. Put it that way. You can minimize your risk, but you can't avoid them. And so just as we deworm our pets, we should be deworming ourselves at least once a year, if not twice a year. And then I shared, the sicker we are, the more infested we are. So someone who's had MS for, let's say, 30 years, the infestation is a lot more advanced in all the way into the central nervous system and has caused a lot more damage versus somebody who's catching chronic disease earlier. Maybe they don't have a diagnosis yet, or they're just getting a diagnosis, or maybe within the first couple of years of their diagnosis. So that's why the sooner we treat, the easier it is to treat. It's not easy, but it will take less effort to treat, and not as long and not as costly, and the quicker we can recover if we follow the correct steps. And we'll talk about those also. The next one I wanted to share is that this is a really important insight. There's never going to be a single cure for any chronic disease. So if you want to continue to fund for a cure, that's up to you. But in my experience with my students that are dealing with cancer and MS and PLS and everything from epilepsy to inflammatory bowel, etc., they all have multiple different types of infections in the body. And we call it severe dysbiosis, meaning they're really out of balance. They have far too many disease-causing microbes in the body and not enough health-promoting microbes in the body. And so it requires treating sometimes roundworms, sometimes flatworms, possibly tapeworms. Sometimes these little worms get in our blood, they get into the organ. Sometimes it's the immature forms, the larvae, that make their way into our eyes, into our central nervous system, into our liver. And so we have to understand, and then they also carry their own microbes in them. So they can infect us with Borrelia, the Lyme infections, and etc. And I'm sure others. So we have to understand that when the sicker we are, the more infested we are, and the greater or the more the different types of microbes we have to correct. That's why we're never going to have one single treatment that would say, let's say, treat a tapeworm and a roundworm and a flatworm and filarial worms in our central nervous system and Borrelia and fungal overgrowth. The treatments that will treat fungus would be different than the treatments that would treat certain parasites. And the same thing with parasites. So yes, there might be some parasite drugs that are somewhat antifungal, but they will not be as effective as the right antifungal drug, especially when we're dealing with this all the way into our central nervous system. And with respect to multiple sclerosis, they are finding filarial worms. Dr. Alan McDonald has found filarial worms in every single person that he tested that died of MS. And different studies have found fungal overgrowth in the central nervous system, even in our brain cells, in the nucleus of our brain cells. Lyme has been found in the central nervous system, and also in those filarial worms that are in the central nervous system of people that have died of MS. Those are just 3 or 4. What about the tapeworm little larvae that make their way into the central nervous system? I've shared studies about that get all the way into the central nervous system and cause lesions. So the pockets, those lesions we're dealing with, whether it's MS or other, those are pockets of infection. And we have to understand that we have to return to we're trying to get to a place of balance. So we're decreasing different types. So our students are knocking back. They usually test well for 3 to 5 parasite drugs, and then they'll do that for 14 days at least, and then they will treat fungal overgrowth for at least 10 days, and then they'll take a break, and then they'll go back. On their break week, very often they will use herbs that are more antibacterial, like that will treat the smaller protozoa and also the bacteria, etc., bad bacteria. So, and then of course we're building back the good microbes. So this is requiring a holistic approach. So this is why there's never going to be a single cure, and we have to stop waiting for it, because it's not going to happen. There is not going to be one treatment that's going to kill all bad microbes inside of us. Things like ozone are great, but we're not able to get the ozone into the central nervous system. Of course, we can get it into our blood, but we're not able to treat the small intestines, and a lot of the microbes are in the small intestines. Maybe we could do a rectal insufflation, but again, so it's very limited. Ozone would probably kill a lot of different parasites on contact, but we just can't safely get it into different areas that were infected. The next thing that I wanted to share is that insight that our students are finding is that it's really difficult to get a diagnosis of parasite infection or parasitic infestation. This is because the tests that we have today are very poor. They're not picking up, maybe they're missing it, or maybe it's not in the specimen. They're looking at the eggs, and of course you're not just going to pass a tapeworm every time you send in a stool sample, or roundworms, etc. They like to stay in your intestines until they die and come out. So it's very hard to be tested and to test positive. Our tests can definitely test for very small parasites like different protozoa, Blastocystis hominis and entamoeba, different amoebas, etc. They're very tiny, and they would be more abundant. So labs can pick those up, but those are really usually not the biggest cause of our symptoms. Why? Because many of our students have tested for those and been treated for those, and they're still sick. So those, yes, we shouldn't have them, but we can probably clear them with some of the more, like the herbs, etc., that we're using, because they're smaller. And then our practitioners at this time, so our medically trained practitioners, they are not skilled at treating, or first of all, recognizing parasitic infestations. They're told that parasites are not a problem in developed countries. Only if you travel to other countries would they be a problem. And again, nothing could be further from the truth. So when you go to school for 10 years and you're told that, and you don't learn and you don't know how to recognize people that are suffering with parasites, and you're not comfortable using the parasite drugs, you've never prescribed them, you're not going to use them. And that is the big problem. So again, it's very important to understand that why we're in this position is that you can go to your doctor and you can say, I'm sure I have parasites. And they'll say, okay, well, let's do a stool test. And the stool test will come back negative, false negative. And they'll say, you don't have parasites. Why do you think you have parasites? I have students that even bring pictures of worms that they've passed. And I honestly believe that it's just not what they want to get into. They went to school and they have a certain practice and they're very comfortable with it. They're very busy, absolutely. They have a full plate. And it's kind of like asking somebody who's trained in one field to, let's say a plumber, to learn about electrical work. And they're just really not interested, a lot of them, because number one, it's the time commitment to learn all of this. Number two, they don't have good tests. They don't want to put their reputation in jeopardy. And so the problem is that it just gets passed off and people suffer terribly. And what we do is we're managing the symptoms of the parasites. We are trying to suppress our immune system. We're trying to suppress the war, the inflammation, instead of treating the cause. And when you keep suppressing your soldiers, the immune system, then we end up with more problems in the future because we need our soldiers, we need our immune system to help fight. So again, our practitioners are not able to recognize, they don't have good tests, they're not comfortable with the treatments. And then finally, a lot of the pharmacies that are in our neighborhoods, they don't carry these parasite drugs. And these parasite drugs, a lot of them have been around for a long time. They're very safe, they're very effective, not just on their own, but the way that we're doing it. And this is, again, if we caught them earlier, we wouldn't be dealing with such deep levels of parasitic infestations. But it could be that a local pharmacy, you ask them, can you get this drug in if I get a prescription? Oh yes, but it'll cost you $10,000. And it shouldn't cost that because these are old drugs, where the pharmacies that we work with, it might be $100. Usually, on average, they're about $100 per treatment, per drug. And the students test well for 3 to 5 drug treatments at a time. So it's going to be really tough to get a diagnosis and to get treated doing this on your own today. We're really hoping this changes. I really believe that the best way for this to change is to get better testing. And I am working and talking with different labs. But again, there's a lot of hope for DNA tests, but they don't have all the sequences of all the different worms and the protozoa, etc. And there are limitations with the DNA test. They need to have a good amount of the DNA to pick it up. Otherwise, it'll get missed again. And that is right now about a $700 to $1,000 test. So that's where, with my students, it's like, do we want to spend that kind of money if you're not going to get a conclusive test result? And I'm trying to help my students be responsible with not spending money on things that are not going to give them a lot of bang for their buck. So that's our problem right now. What is the best testing to do at this time? So the ideal would be for students to find, number one, to get samples of the commonly prescribed parasite and fungal treatments, like just one pill of each, to go to a practitioner that would do energy testing. So some of the practitioners, they will do energy testing with, it's like muscle testing. And so where they pull on your arm and you'll hold the sample up to you in your energy field, and they'll say, okay, this strengthens you or balances you, or no, it does nothing for you. And then that is not effective for you. If it's a chiropractor who does applied kinesiology, if it is a naturopathic physician who may use some type of instrument like a Vega machine, or maybe they have a specialized skill of ART, autonomic response testing, which is not a machine, it's just advanced muscle testing, which was designed by Dr. Klinghardt. So when they do energy testing, it does help if they are a skilled practitioner. And this is where you want to find not somebody who did a weekend job. I've taken courses on energy testing, but I would not feel comfortable, confident to be able to say that I really, truly can tell if this is helpful for you or not. So you want somebody who's a practitioner who uses this in their practice every week. Really important. And then they can go through the samples you bring in, and they can say, okay, yes, this one tests well for you, know that. And then you have a list of maybe 3 or 5 different treatments that will be effective for the parasites that you're dealing with. So again, we don't know which parasites you have. We have a lot of understanding of possibilities of what you have because of what our students have been passing, which is, it's typically roundworms for sure, a lot of roundworms, and the very small roundworms are those filarial worms that are found in the central nervous system, but then a lot of large roundworms in the intestines. So again, all of this is energy tested. You find out which treatments are most helpful for you, and then you have to get a prescription from a doctor, and they will write the prescription. What's really important is to have your blood work done before and after a treatment cycle. The drugs, these parasite drugs, are really safe if you use them properly. But again, maybe you're on some medications and we have to make sure there's no negative interactions with what you're taking. Again, there's pharmacists that are knowledgeable. Not all of them are, but the ones that we're working with are very knowledgeable about, any type of negative interactions. But it's important to check into that. It's important to check your liver and kidney function. A lot of us that are sick, we've been on strong medications, and or maybe we have parasites in especially in the bladders, could be in the kidney, but also in the liver. And so maybe we have elevated liver enzymes. And so we have to check our blood work before and after. And what we have found with our students is that if they had slightly elevated liver enzymes, slightly elevated, and they're working with their doctor, that improves over 2 or 3 cycles, and then their liver function is normal. That is definitely an indication that they were dealing with parasites in their liver. It's very important to understand that the prep phase is vital. It's a must for a successful recovery. We cannot solely, I wish it was that simple, but we can't solely rely on herbs. Well, let's say, first of all, diet and exercise. That's not going to help us recover from chronic disease. The infestation is too great. We have to treat it. We have to physically kill some of these parasites off as much as possible. The more we kill off, the more younger we feel, the better we feel. So it's important to, number one, understand that diet and exercise are not going to cause you to be completely recovered. You will notice symptom improvements if you go low carb, if you follow the Live Disease-Free Eating Plan. It has a lot of nutrition, but lower carb. That greatly reduces the food to the infections that are feeding, the foods that are feeding the infections. And so we start to feel better. But if we eat the wrong foods, we feel just as bad, if not worse. And so it's important that we first stop feeding the infections before we treat them. And we need to support the body. So that is the prep phase. And if you have not watched my videos, I talk about that. I've got a ton of videos on YouTube. Things to, let's say, having regular bowel movements, sleeping at least 8 hours at night. We want to be sleeping. If we don't sleep, we won't heal. Cleaning up our environment of certain things, looking at our blood work, supporting our physiology, but making sure that we're opening up these detox pathways. We don't want to be killing worms and having them die in us and decompose in us. We need to get them out. They carry heavy metals, they carry different microbes. We need them out as soon as possible. So the prep phase, what we've noticed with our students is that if students do not follow a successful prep phase, so they're following the eating plan, supporting the body, and then they start to have a lot of symptom improvements. And that is a really important key that I observe, saying that, yes, you are ready to start treating. And then again, the herbs alone are not enough to treat these parasites. We love herbs. We have tried to use them solely, but as we have introduced the parasite drugs, it's been a game changer. And also the oxidizing agents to do enemas and orally. So the oxygen therapies is kind of the layering. I'll talk about that in a minute. But herbs by themselves, you will pass parasites if you're using a good blend of herbs. Some of the common herbs would be black walnut and wormwood and cloves Everything I share is for educational purposes. So if you're on medication, you always have to check with your doctor. You can't just start taking herbs. They are natural medicines. They could interact negatively. But that is generally some of the common herbs that we see in blends. But there are other different herbs that treat parasites that are becoming popular also. You'll see different formulas out there. They will help to treat especially the small parasites in the intestine and sometimes the larger ones. And even things like raw garlic. Our students have a lot of success at the beginning when they're in the prep phase and they want to do something to start discouraging the parasites. They will chop up raw garlic and have it with their meal because it's hot and you don't want to burn your stomach. So they will start eating their meal. They will swallow the garlic on a spoon without chewing it. It's chopped up, and then they will finish their meal. And that raw garlic is so antimicrobial, it really helps them to start feeling better. And they'll do that 2 or 3 times a day. If you're going to try it, again, if you're on any medication, check with your doctor. We've checked with the pharmacist, and he said with all the parasite drugs we're using, there's no negative interaction. But I don't know, maybe it'll interact with what you're taking. So we would start with a half a teaspoon with each meal, and students are working up to about a tablespoon with each meal. Don't do that for long term because it's hot, but students have found that they notice significant symptom improvement. Raw garlic is antibacterial, antifungal, anti-Lyme. It's not going to kill the big worms, but definitely will be, they won't like it for sure. And the students also take a little bit of cayenne pepper, but those are things that are, again, you're not going to recover, but it can be helpful as you're prepping and getting ready. If you check, you've got to work with someone in the treatment phase. You really have to work with someone. You want to make sure you move forward in a safe manner. Very important. So again, everything I'm sharing is for educational purposes. So the prep phase is so important. And if I have a student that maybe didn't have a lot of success in the prep phase, I know they could implement a little bit better, and they want to start treating, it's just the treatment phase just doesn't work as well. They have to go back, implement the prep phase better, and then they notice that it's working better for them. The treatments are working a lot better. So we said that herbs alone are not enough. And it's not just the herbs alone, but we've also noticed that the parasite drugs by themselves are not enough. It's not like if you had strep throat and you took a 10-day course of a certain antibiotic and you were cured. That's not how this works. I would think it would be similar to those of you that keep getting recurrent urinary tract infections. You might go on an antibiotic and it helps a bit. Sometimes it's not clear and you have to go on longer. You might have to use something stronger, but then you get another urinary tract infection. This way, the way we do it is layering different therapies. The prep phase, again, is really important. And then when we're doing the treatments, we're using the parasite drugs that test really well. But then we're also using the oxidizing, so the oxygen type therapies are not interacting negatively with the parasite drugs. And then also specific herbs that are anti-parasitic, antimicrobial, that can work properly or safely with the drugs. When we do all of that, that's when the magic happens. That's when people are starting to, like, we've got 2 students that they've had MS for at least 30 years, haven't walked for 15 years, and we are going to get better and better at treatment. But within, let's say, 10 treatment cycles, 10 to 11, they're starting to stand and starting to use baby steps with their walker. We didn't think that was possible. Or a hand that hasn't been used for years, whether it's claw or clenched, she can start using it again and actually using it, not just moving it, but using it. So it is a very, very exciting time for chronic disease. I just hope you guys, if you like what I'm sharing, please like this video, help me get the word out. If you want more videos like this, make sure to subscribe to our YouTube channel, Live Disease Free, and hit the notification bell so that you'll know when the next training will be out, and you can join me live. You can ask questions. I see there's a lot of comments and questions coming in, and I will answer them. And if I can't answer them all, I'll answer them later for sure. So in summary, Successful recovery requires a prep phase, so stop feeding the infections and support the body. That is the first step. If you skip it, you will be frustrated. You might have a little success, but I'm talking about wanting to recover. You've got to follow the prep phase. And then you've got to be noticing symptom improvements when following the prep phase. Layering the therapies is super important for recovery. Maybe I'll come back to you in 5 years after doing this and we'll say, well, we've noticed that if you increase the doses, it's still safe. The doctors have said that, and the research has said that now. And maybe these certain combinations are going to clear the parasites out all the way into the central nervous system a lot quicker. But at this time, we're using the doses that are safe, that are recommended, and also the layering of treatments, very, very important. And the last thing is that you have to use a holistic approach. You have to make certain lifestyle changes. You have to bring activity. As we get our mobility back, we have to start building back our muscles. We have to clean up our environment. We're living in a time when there are things in our environment that we didn't have to worry about 50 years ago. We have to definitely play that active role. And honestly, the best way to recover, really the only way to recover today, is that you have to play that active role in your recovery. You can go from integrative practitioner to integrative practitioner and spend a fortune. And a lot of people that find me have done that, whether they've done stem cell treatments, they've done CCSVI, and just even visiting with or going to their functional medicine doctor, naturopath, month after month for several years, and they're still sick. You have to understand, and I'm not faulting them. They're doing the best they can. I didn't know the parasitic infestation until we started to see what's coming out of people that have PLS and MS, etc. It is shocking. My students, when they're passing this, they're like, how can I be alive when I have this many worms in me? And maybe it's not even just the big worms that are causing all of the horrible symptoms. Maybe it's the small microbes that those big worms are infecting us with. I really believe that's a big part of it because, when you take garlic, and it's not passing the big worms, then, well, actually, sometimes it does, but that's the same with the herbs. But to have such huge improvements quickly with the eating plan and supporting the body and just doing a little bit of oxygen therapy and garlic, that really shows me that there are smaller microbes involved, maybe the protozoa of some sort. We know that there are a lot of different ones involved, but we're not sure exactly which ones are causing which symptoms. The one thing that I wanted to share with you, thanks to the work of Dr. Alan McDonald, if you have not watched his lecture, you really, really should. You can find a direct link to the lecture if you go to our website, Live Disease Free, look at in the main menu under research, and then on that page, go down to parasites, look for Dr. Alan McDonald's lecture. And in his lecture, he shows pictures of these nematode worms, the filarial, tiny little worms in the spinal fluid and in the brains, mostly spinal fluid, of people that have died of MS. And that is so, so significant. So please watch that. Share it with your doctor. Share it with your neurologist. When those worms are in the central nervous system of of animals, domestic animals. So when those worms make their way into the central nervous system of domestic animals, that's dogs, cats, horses, sheep, cattle, etc., those animals have symptoms identical to multiple sclerosis. They have weakness in their limbs. They have spasticity. They have balance issues. They have terrible fatigue. They have blindness. All of those symptoms. They have numbness, dizziness. So we do know that those filarial worms are probably a really big part of not just multiple sclerosis, but any neurological disease that has those symptoms. That's another huge nugget that we found. So what are the veterinarians using to treat those filarial worms? And that's what we have been, some of the stronger, I should say more helpful treatments have been the ones that are treating those filarial worms, the ones we've been finding in our students that are really helpful. Not all the time, but very, very often. So again, the best way to recover, to save thousands of dollars, is for you to play the active role, for you to understand all of this. And that's what I help people do in the Live Disease Free Academy. If you're at a place where you've just found me and you're like, this is so fascinating, maybe there's hope for me, watch my videos, implement, start to change your diet, start to see that this will work for you. Then what I'd like you to do is, if you're ready, when you're ready and you're like, I need help with this, I need a plan, I need somebody to guide me through this, that's what I help people do in the Live Disease Free Academy. Watch my masterclass training, and you can watch that. And if you're ready, if you're like, I want to join Pam in the academy, I want to be a wellness champion, I'm going to share some successes right now of students that are in the academy right now that are recovering. Then watch the masterclass training. Then you will fill out a form. After you fill out the form, then look for an email from us. And in the email, there will be a coach-a-thon replay that you can listen to, and it explains in great detail the academy. So first of all, learn the masterclass training that I have that's free. It's how to recover from MS, but it's honestly any chronic disease, or maybe you want to prevent chronic disease. And then the coach-a-thon really explains the academy, the cost, what we're doing, all the steps we're taking, because a lot of people have questions about, how do I find a practitioner? How do I get access to the treatments? All of that. We talk all about that on the coach-a-thon. And then you can join right then. Or if you still have more questions, then you can book a time to chat with me and you can get started right away. You can start treating these infections as soon as you like. So I'm just going to before I go to your questions, I wanted to share, again, these are some successes, not all of them, just a few, of students that are right now recovering from chronic disease, not just MS, PLS, and it's important to note that people that have MS, very often they have other diseases also. They might have multiple sclerosis with diabetes, multiple sclerosis, and they've had cancer in the past, inflammatory bowel. I've even seen MS and epilepsy. The longer we are on the disease-modifying drugs, which are suppressing our immune system, then we can end up with 3 to 5 diseases in time, because different microbes, different infections will move into different parts of our body and cause different symptoms, and then we have a different disease label, and then we need more medication. And it's a terrible downward spiral. So student success I want to share. So I'm not going to say their names because these students are just in the program, and the ones, if you want to look or listen to students there from their own words, go to our website, Live Disease Free, livediseasefree.com, or you can go on, I think in YouTube we have a playlist also where we're starting to put them up there. So this student shared, so this is just the prep phase. What's improved just with the eating plan alone? I can now lift my left leg into the car without manually grabbing it and placing it in the car. My balance is better when I'm walking. My mood has improved also. Those are the things I'm looking for in the prep phase. So another student shared, I'm doing great now. So again, she's in the prep phase. Both of these students are recovering from MS. My bladder has improved, no more leg cramps. We don't always see the leg cramps improving just with the eating plan, but there are students that have tremendous improvements just even in the leg cramps. Again, those parasites are less active when we're not feeding them. And then a lot of our symptoms are improving. She shared, I'm sleeping better. I haven't started the treatments yet, but I'm just following the eating plan and I am improving every day. So this next student is recovering from PLS. So now we have 4 students that are recovering from PLS. The first student that found me, her name is Lisa, and you can see her successes on I don't know if I have it on YouTube or on our website, but you can hear. But that was an old update from her. I need to get a new one. But she said that on the last report that she gave me, she is 70% better. 70% better for somebody who was suffering with an incurable disease. PLS is a slower progressing version of ALS. It's brutal. So this student is quite new. So he's just been following the eating plan, and he's already starting to, he is starting to do the enemas. So supporting the body and the eating plan and doing enemas. And the improvements he's starting to see is that he's sleeping better. I'm consistently sleeping longer durations. That's really important for healing. His constipation has improved a lot. The constipation, again, is caused by those parasites. And he's continuing to see a reduction in the tremors that he's dealing with, and sustained improvement going upstairs, less retries per step. So he's already starting to see improvement in his mobility. Overall, I think the biggest improvement is my outlook on recovery. It takes time to believe that you can actually recover. When we're told we have an incurable disease, there's nothing that we can do. And sure, there are some people that are recovering, and it's like, oh, is this going to work for me? And it's such a brutal disease, and so is multiple sclerosis. And so he's starting to see symptom improvements, significant symptom improvements, especially the tremors and the mobility, just with the prep phase. The next student shared, and she's also just in the prep phase, this was definitely my best week. I haven't felt this good in probably 6 months. I have tons of energy, and I'm getting so much done without wiping me out. The next student I wanted to share, so she's just following the prep phase at this time too. The next student I wanted to share is one of our European students. So we have students all over the world. I believe he is in Germany, and he shares that I just want to share first what he experienced in the prep phase, but right now he's on his first treatment cycle. He is recovering from multiple sclerosis. So in the prep phase, he shared, today has been an absolutely awesome day. All of my symptoms have greatly improved. That would include the burning in my foot soles, spasticity, fatigue, right hand coordination, balance, and mobility. But to me, the greatest improvement has been in the burning sensation in the soles of my feet, which is nearly gone. That was just with the eating plan and the prep phase. I haven't felt so relaxed in years. To me, this is just more evidence or more proof that this program works. Also, last Saturday, I was sleeping very well, only getting up once through the night. So that was in the prep phase. Oh, I should also share, I have experienced a recovery in the sensations in my right leg. Last week, I started to feel the sole in my right foot. So those are huge improvements just in the prep phase. So now he has been energy tested, so he did get samples. I actually was able to refer him to a doctor in Germany. And I was at a conference and I met this doctor, which was wonderful. And so I was able to refer him. So he was energy tested and he started on the parasite treatments. And he's also doing the enemas, which he's able to see the worms. So he shared, since I have started taking the parasite meds, I'm feeling a lot of energy in my body. I can move my fingers and my right hand a lot better. This also influences the way that I walk, making it easier and more fluent for me to move. The enemas are helping so much. I am also quite impressed to see how many worms that I'm passing. And so for him, it's more smaller worms that he's seeing with the enemas. And everyone's different. And that's the problem, is that we don't have one cookie cutter treatment. And that's why there is not going to be a single cure. I always feel great after passing so many worms. I have more energy, less spasticity, and better mobility. Today, I'm starting the 10 days of the antifungal medications with my round 1. And then the next student I just wanted to share is she did the prep phase and the first treatment cycle, and she noticed that her balance came back and she had a lot more energy and her mobility improved. She was able to double the distance that she could walk without her legs getting tired. So I think it was 1 block before, and then she was able to walk for 2 blocks without her legs getting tired. Now she's on the next treatment cycle, and she finished 3 parasite drugs and passed many worms. She shared the pictures with me. One of them was really huge, and it was a rope worm. And when she passed this really long worm, she said, every night while I sleep, I was waking up in the middle of the night with foot cramps, spasms, and I'd have to stretch my feet and walk around a bit to relieve it. But since passing that very large parasite, this has stopped happening. And that is awesome. So she's still treating. She tested well for at least 4 parasite drugs. And so she finished the first 3, and then we kept the second one separate. And this is where I work with the doctor and with the pharmacist, and we put together a plan that is safe and effective, etc. So she works in healthcare. She's been involved with the COVID crisis, frontline worker, and she's been able to just handle all of that with the treatment that she's doing. I'm going to go to a few of your questions. I probably won't be able to answer all of them, but if you guys want, go ahead and type your questions in and we will answer them later for sure. Well, there's a lot of comments here. Okay, so hello, Brian in New Zealand. Hi, Aurora. Hi, Dawn. So, Pam, I did type Parkinson's infection in the search. Bacterial infections. Again, this is unfortunately, and same with any disease, they're really focusing on the smaller ones. And it could be that certain bacterial infections are definitely causing some symptoms, but what we're finding is that there is a big parasitic infestation that is probably infecting us with the bacteria. So just focusing on the smallest, let's say Lyme disease or different small bacteria, it's not enough to recover. That's another huge insight that we've learned. Hello, Sherry. Hi, Kelly. Hi, Patricio. Thank you. The hugs from Florida. I'm glad you enjoy this information, Patricia. I know it's really hard to find a doctor, and I help students to get the treatments and to find doctors. Okay, and I got that. Parkinson's is caused by infections also, absolutely. There's no doubt in my mind. Hi, Amber. Tapeworm drugs show promise for Parkinson's. Oh, that's interesting. And sometimes it's not even the tapeworms. Like we could have a tapeworm in us that maybe isn't causing like disease symptoms. Maybe we have gut issues a little bit, but it's their eggs that hatch and larvae. So it's the immature forms that make their way out of the intestines, get into the blood, they get into different parts of the body, they get right into the central nervous system. And I've documented that in different Facebook Lives or YouTubes that I've done. So you can look at that research. Yes, you can definitely have salt. The salt is not going to hurt you. We definitely need to have the minerals, etc. The zapper isn't enough. Radio Joe Head. I actually bought a couple of different zappers. I do love the work of Dr. Hulda Clark. She definitely is a pioneer. But what we have found is that I have the handheld zapper. Maybe you guys have that where you put your feet on the plate. I bought that many years ago, and it's not enough. It possibly might get rid of some smaller bacteria, but we're using things that are a lot more effective for that. Definitely won't touch the large parasites. And then I also bought that little green zapper. Some of you might know what that one is, and I wore it for quite a while and doesn't do anything. Why is my iron low during my menopause? So Aurora, in the developed countries, a lot of us have we think it's menopausal symptoms. We think it's our hormone. What my experience has been with our students, because I do work with a lot of women in their 40s, 50s, 60s, and into their 70s and younger, but the ones that are going through menopause, when you correct the infections, because a lot of the symptoms are caused by the infection. So when you correct the infections, you bring down the bad microbes and you increase the healthy microbes. You give your body a lot of nutrition. All those symptoms go away, and you can go through menopause without any symptoms. And so a lot of women, they think that it was their hormones. They were on, let's say, hormone replacement therapy or on bioidentical hormones. And then as they have treated these infections, they're like, oh, I guess that's what it was. All these hot flashes was just different infections. We know that certain microbes can cause the hot flashes. Those might even be the smaller ones, like the protozoa, etc. Like I think it's Babesia, I don't know if it's Bartonella or Babesia for sure. So they can cause the sweats. And if you are treating them, you'll see that you just gracefully ease into menopause without all these terrible, terrible symptoms. The low iron, the parasites are definitely the biggest cause of low iron. Also, if you have heavy menses, if you have a very strong flow of your period, that can definitely cause us to be deficient. But then that heavy flow there's this terrible thing of a circular effect. So if we're low iron, we might have a stronger flow. We have to build our iron up. but we also have to treat the parasites because they're a big part of the low iron also. Couple more questions and then I got to run. We've been here almost, we've been 50 minutes for sure. Hello, Brian. So there is a metabiome stool test, which is much more comprehensive. I'll look into it, but I just don't think it's really worth it. Yeah, I honestly, like, you can do it. It's not going to hurt you, but I'm very conscious about people spending $500 to $1,000, and I honestly have not, and I've looked at many results from comprehensive stool analysis and different types of stool tests, and I have not seen anyone that has found anything worthwhile. They'll find anaerobic bacteria, possibly fungi, but if you have a lot of symptoms of fungal overgrowth, you don't need a test for that. So I just haven't seen the value in the results that we're getting. And with the DNA testing for Lyme disease, that is helpful, but we've done that in the past, but again, it's $500 or more. I think it's gone up now. And is that what's causing, you might have Borrelia showing up inside of you, but is that what's causing your symptoms? If you have a lot of symptoms of the Lyme infections, then you may have to treat them. You can just go on symptoms, right? So you first treat the parasites and the fungus several times, feel so much better. And then if you need to treat the Lyme, it's a lot easier to clear it then because you've decreased the bigger microbes that are suppressing your immune system and possibly infecting you with the Lyme infections. So what's a good dose of the omega-3? I would follow the bottle dose of what it is. You can take it, but we haven't noticed a significant improvement with omega-3. It's a healthy thing to take if it's like, we like the fish oils, but we like the fish oils that have been distilled because it's removing some of the heavy metals and toxins. But again, it's something you can take. So we don't take a lot of supplements in recovery. We just take a good plant source vitamin, mineral, maybe a little bit of extra calcium. Vitamin D, if we don't get sunshine, we would prefer students to get sunshine, not in the heat of the day because they can't tolerate it, but definitely that is very helpful. Okay, so let's see, I think that I'm gonna let you go because there's a lot here. I won't be here next week. I have another appointment, but the following week, I just wanted to pull up next week, here we go. So the following week, I'm going to be talking about digestive symptoms and sleep disturbances with parasitic infestation. So a lot of us that are dealing with chronic disease, we have a lot of gut issues, and we also have a really difficult time falling asleep and staying asleep. So we're going to talk all about that and how that is related to parasite infections or parasite infestations. So with that, I hope you have an awesome week and we will talk to you soon. Please, again, like this video, help me get the word out. We have to be talking about infections. This is the answer for all of us. Please share this with other people. Please like it. Please subscribe if you want to join me live in future trainings, you can subscribe on Live Disease Free. And you can also hit the notification bell so you'll be notified. And finally, if you are at the place you're like, I get this is the answer that I've been looking for, watch my masterclass training, How to Recover from MS. Make sure to reach out to me and you can become a wellness champion and you can start on this journey to treating these horrible parasites, getting them out of your system and getting on with your life. So with that, I hope you have an awesome week. Take care and bye-bye for now.